Welcome to Mad Medicine with Miss P. I've got quite a bit here, but I'm going to try to keep it at 15 minutes. I had to start with this one. Now, this is the last on my list, but I got this yesterday, so I have to start with this one. And this was sent to me, a screenshot from a coworker, and this may be my most favorite thing I've ever gotten. Now, I'm going to bet. I'm just guessing. I have a feeling this is like a 80-year-old man who is just silly and fun, and you just never know what's going to come out of his mouth, and he's just fabulous. So in that box where they write how we can make your stay better, how we can improve your experience here at our facility, this patient writes, and I really don't know, that it could have been a 30-year-old girl for all I know, but I'm going to bet, if I look into it, this is a silly 80-year-old man who's just a pistol. He writes in there, provide attractive and pleasant nurses. How do we decide which nurses get to take care of him? Provide attractive and pleasant nurses, or her for that matter. Maybe she's a 30-year-old that wants a big, hot, strapping young nurse to take care of her. I don't know, but that was one of my favorites. Okay, I'm assuming I left off. I don't know if I mentioned this before, that a patient said that he was told, or that he decided to stop his PTSD meds before surgery. I think like everything in me shouts that that's a bad idea. And that's not how those meds work. You can't like start and stop them whenever you want to. Most of them are like SSRIs or the like, to where they require like 6 to 13 weeks to kind of kick in and get you leveled to do the job. So don't stop medications unless we tell you to stop them. That whole like, well, I just thought, no. Don't think. Just do what you're told. You know, kind of like when your wife suggests something, don't think on your own. Just say yes, dear. It's that simple. Just say yes, ma'am. Okay, so this other patient wrote in that her cat gave her an upper respiratory infections from her allergies. Now, maybe that's possible. Maybe she had like so many secretions that it stayed warm and moist for a period of time. Maybe she's incapable of productively coughing effectively, and she ended up with pneumonia or something from her cat. I don't know. You can't argue with them. You just say, okay, I just wish I could be at the front desk constantly watching these anesthesiologists like the one. I love this new guy. And I don't know if I told you this last week, but a patient said, I don't know if I ever even wrote this down. It was just, I just happened to be there at the time. A patient said, I heard two OR nurses talking, and they said, like, oh yeah, she said she's allergic to betadine, but if you wipe it right off, after you put it on and then just, wipe it off, it'll be fine, so we can use it, I guess, as a prep or whatever. I don't even know what surgery they have that they would use betadine. Most of them are like Hibiclens or Surgiclens, something like that. But the anesthesiologist that was up here, he's so cute and he's so quiet and really doesn't say much, but he's that like real smart guy that just, stays quiet and just kind of listens. And he wasn't even in the conversation, but he kind of looked up and I caught his glance and I was like, yeah, I know. And he goes, that's not how betadine works. Like you have to wait for it to dry. Betadine is just water unless you let it dry. That's when it's effective. You have to let it dry. And I learned that 30 years ago when I'm painting a patient for liposuction, which is really super comfortable for everybody when they're standing on this little step stool and you're on your knees in front of a naked man or woman and you're just painting them with betadine. Now, we try to like use like an ABD pad and kind of tuck in, or like sometimes netting panties depending on where we're doing our liposuction, but you paint them with betadine and it is sticky and it's miserable and it's uncomfortable and it feels like dial soap on your face. I mean, it's just tightening and miserable, but it works when it's dry. So you paint them and then they're kind of standing there, and as they're drying, you then let them lie down on the table, then they are put to sleep and you begin liposuction, and that betadine has to be dry to do anything. So when the anesthesiologist goes, that's not how betadine works. You can't, like, apparently people don't realize that. So Just FYI, if you want to use betadine to sterilize the skin, sterilize meaning kill all organisms, you have to wait for it to dry. But I just thought that was precious. Cat URI. Okay. And here's the other thing. Like, I don't know how to get people to just answer the yes or no questions. I called one person yesterday. I was in like 3 different areas and just kind of yanked all around, and I just go where I'm told. So I get on the phone, I'm calling this one person, and I'm on the phone with her for 44 minutes. And it's the same as always. Have you seen a cardiologist for anything more than testing or checkups in the last, 5 years? Or have you ever seen a cardiologist for anything more than testing or checkups? Which means if you're about to say, yeah, I went to one 6 months ago to have a full physical, that's testing and a checkup. I don't care. We want to know, do you have some sort of medical cardiac history? And she says, yes, I've had a stroke. Okay, I don't understand what you don't understand. For the girls in the back, a stroke is in your brain. It is not in your heart. It is not heart related. Yes, it could be directly related to uncontrolled hypertension, which you may see a cardiologist about, but that's only because your primary let it go so long that now you have cardiomegaly, left ventricular hyperplasia, and all kinds of problems. Atherosclerosis, atrial or aortic insufficiency, and stenosis from all of the beating that has been taken from your uncontrolled hypertension for 30 years. Not your cardiologist problem, and really not even necessarily anything wrong with your heart at this point. And it's coming. But a stroke is in your brain. A cardiologist cannot help you with a stroke. That's not why you see a cardiologist. They're completely different things. So finally got to the bottom of it, and I said, I all but yelled, but why did you see a cardiologist? Then she says, so tricuspid regurg, like significant tricuspid valvular regurgitation with palpitations. And I was like, okay, I'll go ahead and write that in, and I'll send off for information, but I'm sure there's nothing we're going to do about it. But, I didn't tell her that. I just said, okay. So because I was on the phone with her for 44 minutes, it reminded me of this other person I talked to, and this exact same thing. Do you have any chronic renal failure or kidney disease or anything like that? And I'll say, like, or do you have stones or anything like that? And they'll say, like, yes, I have kidney disease. I'm like, okay, what happened? Well, I had 3 stones. Okay, well, kidney stones are one thing. It does mean you have chronic kidney failure or kidney disease. And after asking repeatedly, finally we found out, yes, not only did she have chronic renal failure, and the lady I talked to yesterday, she says she takes 20, she couldn't pronounce not one medication, like not even close. It was like all the memes you see when someone's like, I take Metropolitan, and you go, Metoprolol? Like, I'm sure you've seen those videos, or the TikTok videos are hilarious. Someone sent me one yesterday. And yes, this lady literally, it started with an F, and then after that, it went south. But then she said, it's my diuretic. And I was like, oh, you mean furosemide, Lasix, right? So she takes 20 every day, and sometimes she takes 80 a day. Okay, so you have chronic renal failure. You have CHF, right? You don't have to admit it. You don't have to like it. You don't have to agree with me, but that's what you've got. So if I ask you if you have chronic renal failure and you say, yes, I have stones, they're not related. Blood flow to your kidneys causing permanent damage is not the same thing as getting a stone. They're not even like remotely related. They're in the same organ, but they're not remotely related. Completely different issues, but you can't make anybody understand that. This one lady had 27 allergies and 30 meds. So if you put that together, that's her IQ, 57. Do you have any problems with your airway? Yes, my esophagus collapses. I'm sorry. Are you under the impression that you breathe through your esophagus? I don't expect you to be a doctor or nurse, but there's got to be a little tiny part of you, like a little tiny part of you that has somewhat an idea of your own anatomy. Like just a little. Like women have 3 holes, and they're like, what? Yes, and we're talking like adult women. They literally don't know. I wonder what I'd be like if I never went into nursing. Maybe I wouldn't know either. This patient had a lumpectomy. They took the lumpin out, Luban, the lumen. The lumen's all, even if that was lumbar, a lumbarectomy, they took your lower back out. Is that what they did? Like just all of them? Mm-hmm. Lapinectomy, his lapin's gone. Lapin, lapinectomy. The old lapin's gone. You know, you may have a lapin. I don't even know. I'm finding out new things every day. I swear, I've told you this before. The foot doctors and the hand surgeons and the ENTs, I swear they're making up anatomy. I've never even heard of half the. And then on the TV, I saw an ad for lapiplasty. I'm like, now they're advertising to have a surgery that I just found out existed a little while ago. Where's your lappy? You got your lapiplasty? You're gonna clean up your lappy. It's real. It's a real surgery. I'm not even kidding. We do them. I still don't understand them. I'm gonna corner the foot guy and ask him. I did ask another patient. As you're coming in to see this doctor, we do injections. You know, the pain doctors. And I said, "What's he going to be doing for you?" "Oh, he's going to put some fluid in there." All right. Can you be more vague? Just he's going to inject fluid into your back. All right. You mean a medial branch block, and then I have to explain the procedure? You know, this doctor in the office explained it at least a little bit, at least enough, or gave him some paperwork to go home with to read so that person can look it up. But still, they had no idea what they're having done. Oh, and this other patient has grandmother seizures. You know, when you move like your grandmother seizure. I love my job. Doesn't get any better than this. Swear. Okay, and again, I'm gonna these are things that I'm gonna have to just go over repeatedly because nobody ever believes me. Breast cancer surgery, not a surgery. If you write in for surgery in that little box, breast cancer, that's not a surgery. We could have done umpteen things. Did you have a mastectomy with reconstruction, without reconstruction? Did you have a tram flap? Was it a biopsy? Did you have a needle loke? Did you have a lumpectomy? Was it radical? Was it non-radical mastectomy? Breast cancer, that's neither. Which breast? Is it both? Breast cancer. Oh, okay, but you've had the breast cancer surgery. I've seen. Okay, I understand. Oh, and this is one of my all-time favorites. Now, I really shouldn't be busting on anybody's spelling because if anybody knows me, I can't spell at all. I have spelled my first name wrong before, in high school to Chris. "Hey, Chris, what up?" I sent Chris a note and I signed my name with two G's. That's not how you spell my name. And it wasn't like I was high, so I really don't have any excuse. But this person was coming in for a. Can you see this? A hernia repair. Hernia. This person was going to have a hernia repair. The hernia. They were coming in for the hernia repair, which, I enjoy. Also, it's really not helpful when we call and someone says, "Oh, yeah, I filled everything out online," and then I look and all the meds are empty. They wrote, "No, I don't take any medication." And I call them and say, "Hey, I see here that you don't take any medications." "No, I take a bunch. It was just too many to put in." Do you think we're just going to skip that entirely because it's just too many? Because you're so sick and that's just so much information that we would need to safely put you to sleep and care for you afterwards that it's not necessary putting in there? Okay, so now we're going to have to do it on the phone, one by one, instead of you being able to just do it at home, look at your bottles and, smoke a cigarette as you take your 30 meds. Now I have to put them in one at a time. Stop skipping the meds. In fact, if you fill nothing out but the meds, I know what's up because I know my meds. So I know what kind of issues you're having. I will say, however, the amount of new meds that are coming out is staggering. We are clearly in the wrong field. We need to get in with Big Pharma and pass the poison out because it is just unbelievable how much money they're making. And I just watched this video on Ozempic. Somebody sent it to me and they're like, "That's not a medication at all. It's a peptide." I had no idea. It's a polypeptide that you should be able to get anywhere, but the Big Pharma stole it and now made it some sort of like semaglutide. That's a peptide. It's literally called semaglutide. It's a peptide. But now they've turned it into a medication and it's great for weight loss, except it doesn't make you thinner. It makes you fatter or just lighter. So that's a whole nother issue. And it significantly slows gastric emptying. So it's getting dangerous for anesthesia patients that don't stop it in time. Oh, okay, I'm going to end it with this one because I got to go. But this last one was really good. The nurse came out and told me, she goes, "I had to tell you this face to face. she just talked to a patient that said under surgery she had organ prolax. 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 Organ prolax. Yeah, I'm going to need more. Like, that's not, I don't understand at all. So she said she had many surgeries for it, and she said, okay, well, which organs prolapsed? And the patient said, all of them. Are you saying your liver fell out of your vagina? I don't know what to do with that. First of all, I don't think anything prolaxed, probably not. And are you talking about like a bladder prolapse came out of your vagina? Did all of your other abdominal organs move into your pelvic cavity? That's not, there's not a highway. They're separated. You know, they're different. You can't explain it. I'm just going to take what I can get. Okay, I got to go. Same as always, face your fears, forget your failures, follow your faith. Love you.